Hello, I'm Lawrence D. Wagman, the Executive Medical Director at the Center for Cancer Prevention and Treatment and a surgical oncologist. Today, I'd like to speak to you about obesity and cancer, two important health problems facing Americans. We all worry about cancer, and almost ironically, 35% of the cancers that we get could be prevented by lifestyle changes. These include changing what we eat and drink, maintaining a normal weight, and getting regular exercise. At least 8 cancers have been associated with obesity: prostate, breast, colon, esophagus, thyroid, ovarian, endometrial, that's the womb, and liver. We always wonder why something like obesity could link to cancer. There are certainly very reasonable associations. With obesity and the diabetes which often accompanies it, the insulin levels in the body go up. Insulin is thought to be a growth factor for healthy cells, but also a growth factor for many cancers. Hormones, particularly the female hormone estrogen, is made by fat cells. So as there are more fat cells, there's more estrogen. And we know that many breast cancers are sensitive to the presence of estrogen, increasing their growth. It's pretty obvious that the physical effects of obesity, with the increased amount of fat in the body, makes it harder to do examinations that might identify smaller lumps and bumps. This will lead to finding disease at a later state. There's also a direct damage from fat. This is very well known in the liver. A healthy liver has a very small amount of fat as a normal part of its makeup. In obesity, the liver becomes fatty. It takes on a yellowish look, and the fat within the liver can then damage the liver cells, causing them to be irritated, like hepatitis, not an infection, but an irritation. And these irritated cells then progress to cancers. Let's focus for just a minute on breast cancer. Since that's a very common cancer, it's very well established its association with obesity as increased risk. It's not just that there'll be more risk of getting the cancer, there'll be more risk of the cancer coming back, and less chance of surviving the cancer in obese women. And in addition to that, as the obesity increases, each of those risks, the risk of the cancer coming back or the risk of dying of the cancer, goes up. That puts some importance into, even if the diagnosis is made in someone who's obese, for them to think about losing weight. It's not too late to make a difference at that time. And let's think about all the things that might relate obesity to breast cancer. Well, we already talked about hormones and how the estrogen's greater. But let's think about how we give medications. When we give a cancer drug, we measure the amount of the cancer drug that we're going to give against the weight of the patient. Right now, the way we do calculations is we only do that against the lean body mass. Assume the patient inside the obese patient, the normal size. We might miscalculate. Also think about the difficulty in delivering chemotherapy intravenously to someone whose veins are hard to find, and delays in treatment, which potentially can lead to less complete therapy. The radiation effects on the skin in obese patients can be much more dramatic, more tanning, more thickening, more changes that just don't go away in obese patients compared to normal patients. That's all based on the way we give the radiation and how it has to pass through the skin to the site where it's being delivered. Finally, as effective as the drugs are, we know that all drugs have some side effects. One of the most important drugs that we use in breast cancer are anti-hormones. Side effects of anti-hormones can include joint pain and increased risk of blood clots, primarily in the legs. And those two are also features that are associated with obesity. The joints hurt more because they're larger, and they all have an increased risk of blood clots. So our therapy complicates what's already there. So how can we get beyond all this? How can we have some effect to reduce the risk, make the outcomes better? The American Cancer Society put together several recommendations. The first one, maintain a normal weight. Well, that's something that's a real goal for us. The second is to try to balance some of the caloric intake with physical activity. So reduce the amount of calories that get deposited in us by burning them off with exercise. Besides balancing the energy, it also will increase our heart, our lungs, and our muscle strength. And let's talk about something that's even more aggressive. Right now, there's surgical procedures that are done for patients who are obese. 10 years ago, that might have been something that was quite unusual. But as we've learned over the time course, risk of cancer, risk of heart disease, risk of lung disease, damage to joints, all associated with obesity, can be improved with weight loss. The first step in weight loss is always metabolic approach. Diet, exercise, see how effective you can be in that way. But many times when those fail, after the best efforts, surgical considerations are put in place. And there are several options now, which a skilled bariatric surgeon could advise you about. So finally, prevention. That's the best. Maintain that healthy weight, get your exercise, watch how many calories you take in. Once you've identified that you might be overweight or obese, don't stop getting your regular follow-ups. Keep getting your regular screenings because they continue to be very, very important and valuable. And they won't let you down. If there's something there, it'll be found. Thank you.